Hello, everyone. Good afternoon. Welcome to Dr. Gilead Show. Today is February 15, 2018. I would just want to welcome you back. Thank you for always tuning in to this program. I'm Dr. Theo Swala, your host. Today, we're talking about another topic, pyromania, Pyromania, pyromania. But before we start, it's always good to say this. As you know, please do not use what you hear on this platform to make a diagnosis of yourself or someone else. Please do not treat yourself based on what you hear on this platform. The producers, our guests, and the host cannot be held responsible for what anybody does based on what they hear on this platform. It is always good to get the appropriate diagnosis and treatment from a trained professional. So please always listen. This is purely an educational program to educate the people about behavioral health, mental illness, so that we can know more, be more informed, and get the appropriate treatment. Today, we're talking about pyromania. Pyromania is another interesting topic in behavioral health, in psychiatry. So please pay attention so that if you have somebody, family member, or a friend who may have this, so that you can hear, educate them, give them the appropriate direction for treatment. Pyromania. Pyromania is defined, this is a pattern of deliberate fire setting for pleasure or for satisfaction, and this is derived from the relief of tension experienced before the fire setting. So people set fire for no clear reason, but the thing is here, they get some happiness, they get some satisfaction. Pyromania, the word pyromania comes from a Greek word which is it's a combination of a Greek word, fire, and loss of reason or madness. So pyromania, fire, madness. So it's unbelievable how the brain of a lot of people work. So they do things, they go about, do things that actually you and I will not do normally. But for these people, the way their brain is wired, they just take joy and satisfaction and happiness in setting fire and watch things burn. Now, pyromania is a disorder of impulse control. So they have this difficulty managing their impulse. They want to set fire, the tension builds up, then they set the fire, and they have this calmness, this good feeling, this feeling of satisfaction that the fire is burning. And so people set this fire when they are unable to resist the impulse. They are unable to calm that impulse to set fire. Now, this must be differentiated from organized planning of an arsonist. There are people who, by their behavior, they set fire to destroy things, or terrorist behavior. No, so this must be separated from the arsonist or the terrorist who brings the destruction of property. So, but a person who has pyromania has a tension that builds up. The tension builds up, it builds up, then they can't stop the impulse. They cannot hold back. And boom, they set up fire and they watch it burn. And they feel this calmness, this satisfaction in them. That is classical of pyromania. Now, although pyromania is considered to be a very rare disorder in adults, repeated fire settings in adolescents or young people uh, has become a growing social and economic problem. And this poses a major risk to the health and safety of people, and also safety of our property. Now, in the United States, fires are set by children, by adolescents. These fires set by young people are more likely to result in someone's death than any other household disaster. So the people with pyromania, in the young person, in the child or an adolescent, when this happens, there are higher chances of somebody dying, more than any other kind of disaster that happens in the house. I was looking at some statistic. The National Fire Protection Association stated that in 1998, fires set by juveniles caused about 6,215 deaths. 6,215 deaths and 30,800 injuries, and a total loss of about $11 billion of property damage. That is not a joke. That is not little. You can imagine 6,215 people dying from fire setting, about 30,000 people injured, and property worth $11 billion damaged. That is not a joke. So pyromania is a very serious disease, and we must know much about it. We must know about it. But like I said, there are people who, by their behavior, wanting to get a revenge or want to destroy property of someone, want to get back on somebody, could set a building on fire, set up property on fire. That is not pyromania. That is completely different from what I'm talking about today. Now, pathological fire setters have been divided into 5 categories. People could set fire. Number one, people could set fire as a show of cry for help. And this is not uncommon with youngsters. They set this fire to call for attention. They call for attention. They want people to notice that they are struggling. It's either because they are struggling with something inside them, things like depression or some interpersonal problems, and sometimes even when parents separate, or some physical or sexual abuse. I have a patient who I'm seeing. He lives in a neighborhood where he was sexually molested when he was young by another young man. And he has continued to live in that neighborhood, but every single time he sees the guy that sexually molested him, it throws him off balance. And at one point, he set his mother's house on fire. The house was completely razed down. Of course, the insurance paid for it. They were put in a hotel. But that is one of those examples of when a fire setter could be crying for help. And of course, he was arrested and sent to us, and we've been treating him. He has not set any fire in about three and a half years. So that is one example of those group of fire setters crying out for help. You also have delinquent fire setters. These people are mostly between 11 and 15 years of age. Their fire setting is partly a pattern of aggression, and it may also include vandalism or hate crime. And these people are likely more to damage properties in their fire setting than hurt people. So they are aggressive, they are dangerous. So this is another group of people who set fires. They just want to get back to somebody. The third group are people who are severely disturbed. These may be those who are diagnosed with schizophrenia, psychotic symptoms. They are paranoid, And this appears to be reinforced by their sensory aspect of fire setting. So, and some may set fire as a part of kind of suicide attempt. It's part of their mental illness. They want to, they're either paranoid or psychotic, or they want to kill themselves. The another group is the fourth group are those that are cognitively impaired. So this group include young people or youngsters who have poor impulse control. That they may have things like brain damage from fetal alcohol syndrome, like when their mother had them in the uterus, in the womb, mother was drinking alcohol, so they have brain damage, or other neurological problems that from which they have brain damage. Also, the fifth and the last is the social-cultural fire setters. So these are people that are influenced by antisocial adults in their community. So they set fires to win approval of the big boss in their community. They set fires to satisfy the big man in their community who they want to be seen to belong in the bad. They want to show that they're bad or they're strong or they're powerful. So this is a cultural thing in the neighborhood where they live. So they will have an adult who is a gangster or something, and to prove that I'm matured, I can take risks, they go set fire and they destroy property. So it's not clear. Let's look at what could be the cause, the causes of pyromania. Why would somebody just decide to set fire? It's not clear what the cause could be. Now, but I have tried to divide it into two. What could be the causes, which could be the individual per se, the person, and also the other cause of fire setting could be environmental. Number one, with regards to the individual, is people who have antisocial behavior or attitudes. So these are people who usually they will commit crimes, and they do other things like forcibly, they rape people. 11% of these fire setters have non-violent sexual offenses. They also 18% will have vandalism as a behavior. There are other people who have sensation seeking. Some people, by their nature, are just attracted to fire setting out of boredom or lack of some form of recreation. So they just find something to do. They set fires. And I remember some years ago here in the U.S., a group of teenagers went setting fires down south, set fires in churches, in some places. So they just get a trip. They get a kick from setting fires. Others are those who just seek attention. So, and they feel that fire setting is, it provokes a reaction from their parents or authorities. So they want to do it. There are others who, just because they lack social skills, and you have this, many of these people are arrested. They are arrested, and they are usually loners. They rarely have a significant friendship. So they are loners. They just do things because they lack social skills. They lack interpersonal relationship. They don't have friends. They don't have people they interact with. Others are those who lack fire safety skills, and it's mostly due to ignorance of the dangers associated with fire setting. So they set fires. They just turn on the lighter and they look at it and they throw it away. Boom! It catches up on the carpet and brings a lot of destruction of property. That is the individual, but we really don't know what will make anybody set fires. Now, there are other things that we could observe, and these are things like environmental. There are environmental factors that may cause an individual or an adolescent to set fire. And this could include poor parental supervision. And that's why, as parents, we must keep an eye on our children, on our youngsters. If a child is not supervised, there are high chances they will do all manner of things. And if you ask them, well, why did you set the fire? And I don't know. They just do things that don't make sense. Other environmental factors are things like early learning experiences of watching adults use fire carelessly or inappropriately. There are people who they smoke cigarette and they're laying down on their bed, they drop the cigarette, or they just smoke cigarette and they throw the butt somewhere, and before you know it, it catches fire. So the child at a very early age becomes careless about fire. They learn from bad behaviors of their parents. The other environmental factors are things like parental neglect, or if the parents are emotionally uninvolved with the child. So for us parents, for family members, we must connect to our children. We must not neglect them. You must connect them emotionally so that they can attach to you. They can know what is good and bad. Other environmental things are, it's been shown that children of parents who have psychopathology, who have parents who have mental illness, and these parents will physically or sexually molest or abuse the children. When these children witness such abuses or drugs or parents acting out violently, these children end up setting fires. These are not uncommon things that could make a young person, set fire. Other things are peer pressures. Peer pressures. I have had a patient who, a group of youngsters, they're passing by, they said, man, let's set fire on that thing. And they said, you go do it. And the person who wants to show that they belong to the group, without thinking, they will go set the fire. And of course, they are caught on camera, on CCTV, central TV. They picked up, while the other persons are not picked up on the video. They are caught. So peer pressure could make people set fires. Other things, other environmental factors are things like stressful life events. So some young people resort to setting fire as a way of coping with life crisis, as a way of coping with losses, as a way of coping with limited family support, or dealing with their crisis, the crisis in their life, loss of parents, loss of family. So a lot of things, the individual makeup, the environmental influences can make people set fires. But whichever way it is, whether it's individual or the environmental factors, we must, as people, manage our family, take care of our young ones, support them, and we'll see that they will do well. But if they are neglected, if they are not cared for, if we show bad example, drugs, fighting, criminal activities by parents, this could lead our young stars to begin to do things that are illegal. Set fire on properties, set fire on places that will cause problem, destruction of property, and could kill people. How common, how prevalent is pyromania? It's not clearly known because this is a disease that is not well studied yet, but a sample study done shows that about 1.13% of people, of the population, could have pyromania. But if we look at the people that reach the criminal justice system, about 3.3% of people who have pyromania identified among those that reach the criminal justice system. And we know that pyromania occurs more common in males, especially those with poor social skills and those with learning disabilities. So it's not very common in females, but very, very common, much more common in males than in females. And it occurs more in people who have a poor social skills, a poor way of relating with other people. I always look at things that could co-occur. What are the other things that could happen when people that have pyromania? Other co-occurring illnesses are substance abuse. Substance abuse, people smoking marijuana, people doing drugs, cocaine, PCP, alcohol, are more predisposed to fire setting. Those who have gambling disorders and those who have other mental health issues like depression, bipolar disorder, these could commonly occur in people with pyromania. Other things are people with poor impulse control disorders and conduct disorder. This will occur in people with pyromania. So let's look at what are the symptoms of pyromania. What are the things that will make us say someone has a pyromania? The Bible of Psychiatry, which is a diagnostic and statistical manual of mental illness, which is what we use in North America and I believe worldwide to make a diagnosis of people with mental illness. The DSM-5 clearly states out 6 criteria that must be met before you can say someone has pyromania. Number 1 is that the person must have set fires deliberately and purposefully on more than one occasion. So someone intentionally, deliberately sets fire, and it has to be more than one time. That is one criteria, one of the criteria that must be met. That's deliberate and purposeful setting of fire, more than one occasion. That's one. Now, number 2, the person must have experienced feelings of tension and emotional arousal before setting the fire. And what is that? So someone has this buildup of tension inside them. They feel that they have to do something. They feel this tension building up in them. They want to do it. They feel the excitement or the tension building up. So before they set the fire, they must have this tension build up. And the emotional arousal, it builds up, then they set the fire. So that is one criterion. One criterion. There has to be an internal tension. It builds up, and then they set the fire. So that is the second criterion for you to say someone has pyromania. So number 1 is deliberate and is purposeful, more than one time. Then number 2, it builds up inside them. The tension builds up, then they set the fire. Now, number 3, the person must be fascinated, must be interested in fire setting, must be attracted to it, and must be curious about fire and the situation surrounding the fire setting. So they must express it. They indicate that, listen, hey, I have this tension, it builds up, then I'm fascinated about watching the fire, I'm interested in setting the fire, and they are attracted, they are curious about the fire and the situation surrounding the fire setting. So for example, they may have the equipment associated with fire, the uses of fire, and they also understand the consequences of fire setting. So they know that this could cause destruction of property, this could cause harm to somebody. But they have this tension, it builds up in them. They cannot wait to see the fire burn. They watch it, the tension builds up, then they light it, and they sit back and they watch it. They feel the tension deflect. They feel the tension go down. That is a classical, one of the classical criteria of pyromania. The fourth one is they experience pleasure. They get some gratification. They get some reward. They have this relief or satisfaction when the fire is burning. So you can imagine someone who sets fire one time, more than one time, and before they set the fire, it builds up, the tension builds up, they begin to, cannot wait to see it happen, then they cannot hold back the impulse. At the end of the day, they set the fire, they watch it, they feel happy, they enjoy to see it happen, and it brings a great relief. They feel satisfied as they watch the fire burn. And they also enjoy to see the aftermath, the outcome. They see the destruction. It gives them a sense of good feeling. That is something out of the ordinary. How would somebody feel that way? But you say this person is crazy, but that is the illness we're talking about. That is the mental illness we're talking about. Now, it's also important to note that, one, this person does not have any other motive for setting the fire. There is no financial gain. There is no financial motive. They don't gain any money. It's not that they want to destroy somewhere so that they can get insurance money. No, it's not that they want to cause the destruction so that they can punish somebody. It's not that they want to get back at somebody who had made them angry, or who they want to avenge somebody who caused them some problem. No, it's just that they have the feeling, they feel this tension, and they bring that destruction of property, and they watch it happen. They enjoy it, they love it. Two, the fire setting cannot be from a desire to cover up a crime. No, it's not to cover up a crime. It is to set it and to relieve tension and to enjoy watching it happen. Number three, the fire setting is not from a hallucination. Like, I have some patients who hear voices telling them to go set up a fire, go destroy that house, go burn down that building. No, that is not pyromania. If they are hearing voices telling them to go destroy a place, that is not fire setting. Mental illness is so terrible. And every time I see patients who do certain things, it breaks my heart. And they don't know, they don't want to do it. But this is not what we're talking about here. The fire setting is not for revenge, is not for money, is not to cover up a crime, is not out of a delusion or a hallucination or hearing voices, and it's not because they have impaired judgment. No. And it's not also as a result of, or they smoked something, or they used some drugs, or they have an injury, traumatic brain injury. That's why they are bringing destruction of that property. No, none of those things. They're doing it to get some relief, some feeling of satisfaction to watch it happen. Also, this fire setting cannot be accounted for by other behaviors like antisocial personality disorder, which we talked about on this platform. People who have antisocial personality disorder, they just go ahead, they don't care about the feelings of other people, they don't care about what happens to people, they don't care about what they do to people. They don't care. They just they enjoy to watch people suffer. No, that is not. If that happens, that cannot be said to be pyromania. It is also not because they have a manic episode. No, but it's just that they have this tension built up in them, and they cannot hold the impulses. They go ahead and bring such a destruction to the property. These are the classical symptoms as enlisted by the Diagnostic and Statistical Manual of Mental Illness, and if they meet these criteria, they can be diagnosed with Pyromania. At this point, don't go away. We're going to take a break, but I want to recognize a few people who have joined. Around Jones, Joseph, also, okay, Anna, also Victor, Prince Will, guys from all over the world, from California, from Nigeria, from Sweden. People are calling in everywhere. Thank you for tuning in. Victor says, nice one, Doc. A lot of people are joining. This is a great topic, and you can send in a question. You can send us a tweet or send a question or a comment on our Facebook page, and we can bring it up and discuss it with our audience. Before we take the break, I want to thank one of our sponsors, Paddock Healthcare Pharmacy, for being a good sponsor of this program. We are on WBGR Radio. You can also call on 301-429-9247, 301-429-9247. We're talking about Pyromania. We're going to take a short break. Don't go away. Please stay tuned. We'll take a short break. Thank you.
When's the last time someone said thanks for checking over your shoulder before changing lanes? Or gave you a pat on the back for sticking to the speed limit? Or a thumbs up for not tailgating? Probably never. Which is too bad, considering safe drivers make the road safer for everyone. That's why Allstate appreciates safe drivers like no one else. And they show it by saving you 45% or more, along with giving you safe driving bonus checks, deductible rewards, and extra discounts with the DriveWise app. So the next time you come to a complete stop in an intersection, ask yourself, why haven't I switched to Allstate?
The Brandeo Insurance Group, your local DMV Allstate agent, can help you save 45% or more for driving safely. Call him at 410-424-0844 and get a quote today.
It pays to drive safely. Call a local Allstate agent today and find out how you can save 45% or more. Switching to Allstate is worth it.
Savings vary, subject to terms, conditions, and I've always wanted to go to Peru. I just never had the time. But that never stopped me from eating their delicious food. Come on down to Peru's Chicken in Lanham, Maryland, or Mitchellville, Maryland. Their spices will take you to Peru.
All right, ladies and gentlemen, thank you. Welcome back to Dr. Gilead Show. Today we're talking about Pyromania. Pyromania is fire setting, and that is, as I said before, from a Greek word, fire madness, pyromania. People, because of the way their brain is wired, they set fire, and the tension builds up, and they set the fire and they enjoy to see it burn. They enjoy to see the fire burn, and they feel some level of calmness and satisfaction when the fire is burning. That is pyromania. We've talked about the prevalence. We've also talked about the symptoms. Now, there was a question during the break time. Someone asked, can they be legally charged and imprisoned if they set such fires? And the answer is yes or no. If someone sets fire and they are arrested, they can go to jail. But if they have a diagnosis of pyromania and the psychiatrist can prove that actually this patient has pyromania, they should not go to jail. Why? Because who in their normal senses will go set fire and enjoy to see it burn? That person is sick. And this is the dangerous thing about mental health issues. The question is, why will somebody kill their children? Why will somebody drown their children? If we remember some years ago, a lady had her children, I think 5 or 6 children, put water in the bathtub and took one after the other and drowned them. That is a mental health issue. Nobody can have children and kill them and drown them. That shows that the person is sick. Nobody, how can somebody put their child in a microwave? That person is sick. If you jail the person, they come out the next time they were going to do it. So the question is, why would somebody feel this tension to set fire? And they go sit back, they plan it, they cannot resist the impulse to set the fire. And once they set the fire and it's burning, they go relax somewhere and watch it burn. And they feel this satisfaction, they feel this calmness. That is pyromania. That is the illness we're talking about here. No normal thinking person can do that. So if you arrest the person and you put them in jail, it does not make a difference. They will do it again unless they get the appropriate treatment. Another person asks, what if somebody dies in the fire setting? Usually people die. Like we said, we gave the statistic the first time. In 1998, about 6,000 people died from fire setting. So the question is, was this fire set up by someone who has a diagnosis of pyromania, who has a mental illness? Or was it that it was somebody who just wants to avenge someone who did something wrong to them, or who wants to cover a crime scene? These are completely different things. So if somebody dies or a property is burnt down, it is the responsibility of a representing attorney of the patient or the client, as the case may be, to prove that this person has the mental illness of pyromania. And if they meet the criteria of the diagnosis, as I stated before, they cannot be held criminally responsible for what they did. So, and that they can be set free based on insanity, and they cannot be held criminally responsible for what they did. So that's why, as a people, we must be observant. We must get help for our family and loved ones, so that if they have a mental illness, they can be appropriately treated. Also, let's look at the complications of pyromania, this disease called pyromania. Now, one obvious complication of pyromania is loss of life. Somebody can die when a fire is set in a building or in a place. Loss of life is one complication of pyromania. Also, destruction of property. Properties are destroyed every year. And if you remember the statistic, in 1998, we said that $11 billion worth of property was destroyed by fire. And this is huge. So destruction of property, loss of life is one of the complications of pyromania. It also affects the relationship of the individual that has a mental illness and their family. Because, hey, who burns down the house? Who destroys the property? And no family member wants to deal with you. So it affects their relationship with people, their family members and their friends. Also, another complication of pyromania is it affects their mood. And this could cause some mood disorders, depression, anxiety, because you set fire and the tension builds up. The tension builds up. They become nervous. They become anxious. The patient I talked about initially, he would always get nervous when he's feeling like setting fire. And he will call. Say, man, I'm feeling bad. I don't like the way I feel. I want to see you right away. And he will come in and we'll talk about the fire setting. We adjust his medications and he will go back and he will feel calm again. So this is an illness, and some of the complication is the people develop very severe anxiety. They don't really want to set up fire, but they have this tension build up in them. As the tension builds up, they don't want to do it. They don't want to do it, but they cannot resist the impulses of fire setting. At the end of the day, if they do not get the help that they need, they set up the fire and it calms them down. But if they get the help they need, there's no destruction of property or loss of life. People with pyromania also have the complication of alcohol and other substance related problems. People who have inattention, if it is coming from pyromania, what they do is they go look for alcohol or other drugs that calm them down. Once it works, next time they continue to use, before you know it, they become addicted to it. So they're doing drugs day in, day out. They self-medicate to keep themselves calm so that they don't set up fire. So one complication of it is substance abuse, drug use. The other one is harm to the individual. Sometimes they may get burnt themselves. They may be killed in the fire. They also may set fire on other people. So loss of life is a big complication. And also, number 5, they have a lot of legal problems. A lot of legal problems, like the question somebody asked, they may go to jail. They may go to jail, they may be imprisoned, or they may be put in jail for an extended period of time. So legal problems. Also, they may be charged with the destruction of property, and when they get out, they are made to replace those properties that they burnt. And you can imagine, while they are paying back the restitution for what they destroyed, they set up more fire. They set more fire, and they have more and more problems, more and more legal and financial problems. So legal issues, legal problems is huge with people with paranoia. How do you treat this illness? This is a very complicated illness, very difficult to treat. In children and adolescents, we in the treatment, you bring not just the individual, but the family. Why? Because a lot of young people who take part in pyromania come from very, very chaotic family setups. They come from family setup where there is fight, where there are drugs, where there are all kinds of problems. And so you have to work with them in those families to help them manage the situation. That way, so they don't run the risk of setting up more fire. In the treatment, you evaluate the stress on the family. You evaluate the stress on the individual. Then, once you know the stressors the individual is going through in his family, the stressors the whole family is going through, which may drive the individual to set fire, then you begin to develop a pattern of supervision, a pattern of discipline to manage the stressors he's going through. So he can learn that setting up fire doesn't solve his problem. If anything, it complicates the problem. So you evaluate the family, evaluate the individual, and start patterns of supervision and discipline. That's number 1. The next stage in the treatment is tailored to the individual. In his house, and also you check at the home front. Now, a variety of different treatment approaches have been advocated. Number 1 is problem-solving skills. We must teach them how to solve some problems, because a lot of people who have pyromania have poor social skills. They do not know how to take care of their problems. They do not know how to interact with people and talk on situations, but they will withdraw and isolate. And once the tension to set up fire builds up, they go set up fire. And they damn the consequences. They don't think about the consequences. They don't think about the outcome of this problem. So we teach them problem-solving skills. How do they solve their other problems? How do they manage their situations instead of setting fire? What should they do? Also, in the treatment is anger management. As we know, people with pyromania may be going through other psychological problems. And what do? They learn how to calm themselves down. They learn how to manage their anger. So anger management is key in the treatment of an individual with pyromania. Excuse me. The other treatment modality is communication skills. They must learn to improve their communication skills. They must learn to improve how to relate with other people. How do you tell somebody that I'm feeling like setting fire? I have this tension in me to set fire. I have this feeling like I have to set up fire because I am feeling like setting up fire. I feel like watching something burn. I feel like having fire set up somewhere. So, but if they have the ability to communicate with people, they have the tendency to relate with people, they can communicate with people. So they must develop a good communication skill. They must develop a good way of letting people know what they're going through. So once they manage their anger and learn communication skill, that might be very beneficial. Another modality of treatment is aggression replacement treatment. So when they get aggressive, when they get angry, they will learn, or they are taught other ways of managing that aggression. They are taught to understand that if you set fire and you're watching it burn, it does not solve the problem. If anything, it has made the problem worse. That is the aggression replacement training. So they are trained to replace the aggression with other things. Also, we talked about cognitive restructuring. This may be very necessary to address all the emotional and cognitive issues involved in each case. So the provider will find a way to look at the emotional and the cognitive issues that may predispose this individual to setting up fire. This is mostly for young people and adolescents. If we look at adults, treatment of pyromania in adults is considered very difficult to treat because these adults lack insight and cooperation with the treating staff. They don't see any sickness in them. They don't see any illness. They don't think that something is wrong with them. No. As far as they are concerned, they're doing well. They are serving. They're doing what they are supposed to do, and it does not bother them. They don't think there's anything wrong with it. Once the tension builds up in them, they'll go ahead and set the fire, and they feel satisfied. They feel like they have done what they've been waiting to do all this while. So it gives them that feeling of satisfaction. So our treatment usually consists of a combination of medications. Sometimes we use the selective serotonin reuptake inhibitors, the SSRIs, and these are medications like Prozac, Paxil, Zoloft, and Lexapro, and citalopram. So these are the serotonin-specific reuptake inhibitors, SSRIs. When people take them, it helps reduce that poor impulse control, and they can think before they do things. The other things are psychotherapy, mostly long-term, insight-oriented psychotherapy. Once they get in therapy. The therapist will dig into why they're doing what they're doing. They look at how this all started. So is it from abuse as a child? Is it from growing up in a very chaotic family? Is it from any cause which we can't put our finger on? But the therapist will talk with them, and in course of taking history, the therapist may pick up life-changing events, how they relate to family, how the parents related among themselves, how the things they've gone through in life before they get to the point where they are setting up fire. And once you identify what the situation is, the therapist will begin to work with them on what we call insight-oriented psychotherapy. And that is helping them to understand and see the dangers in what they are doing, the problems that could arise, and they will see it, and they may make some changes. Another question is, what is the outcome, what is the prognosis of pyromania? Now, the outcome depends on a lot of things. It's known that children and adolescents who set fire, some do it as a cry for help. Some do it as a way of saying, listen, I'm not happy. As a way of saying, something is going on with me. I need help. But they don't know how to put it. They don't know how to say it because they don't know exactly what is wrong with them. But a lot of the times, at the end of the day, they get, at the end of the day, they feel better when someone hears them out and gives them the help they need. Also, if there are people who are cognitively impaired or people who are in the social-cultural categories, these people may benefit from therapy, from psychotherapy. They may benefit from the kind of therapy that we're talking about here. And they will learn not to obey that kingpin in the neighborhood who makes them bring about this destruction of property and fire setting. Now, in adolescents and young people, the prognosis, the outcome is much better. They can, over time, they can get better, and over the years, they can know that they'll come to the realization that this is not acceptable, this is not good. So people with pyromania from a young age have higher chances of getting better compared to individuals. But in adults, the prognosis is generally poor. It is poor. They end up not doing much. They end up not getting better much. So what happens is they go out and continue to do it, but they end up in jail, get long jail times, and that will keep them off the streets, because we know that it's not acceptable. So, but in adults, it is difficult to treat because they don't understand what they're doing. You cannot change their thought pattern or the way they think. So generally, the prognosis is poor in adults compared to young people and adolescents. How do you prevent pyromania? Prevention required a broad-based and flexible approach of treatment. You have to treat the young and adolescents, as long as they are young and as adolescents, the treatments will help them not to set fire overall. Also, a good assessment of the individual's family uh, will help prevent this fire setting. People who come from very chaotic families, people who come from a family where there's always fight, or people who come from families where parents have a mental illness, they're doing drugs, they're fighting, these people have high chances of developing pyromania because they have not learned, they have not been taught on the dangers of fire. Parents are careless, parents are fighting, parents are separated, they are going through all kinds of things. And the child has no supervision. They end up having fires all over the place. Or the kids who have been physically or sexually molested in their late adolescent age may have this problem, but if it is appropriately treated, they are educated, it may be prevented. So, ladies and gentlemen, today we've talked about pyromania, which is intentionally setting fire, not for revenge, not to make money, but it's just a poor impulse control. They have this impulse to set fire, and it builds up, then they set the fire, they feel this calmness, they feel this feeling of fulfillment. That is pyromania. So today we've talked about pyromania, but the essence of this is to have family members listen to it, even individuals listen to it, so that if you find that a family member or a loved one, a friend, has this behavior, you can get them help. You can take them to treatment. You can arrange for them to be seen. And that will solve a huge problem that this could cause. Parents will, if you have a child, get them help. And that will solve the problem, at least prevent any fire setting. So if you have enjoyed this, you can also look at it on YouTube. Go to Dr. Gilead's show, and you can listen to it, and you can refer people to go listen to it. I want to say thank you to all those that tuned in. Oral Jones, Joseph Abba, okay, Waja, Anna, Mary, Princewell, Victor, Michael, all from here in Maryland, Nigeria, also California. Thank you all for tuning in today. We'll meet here again Thursday next week at 1 p.m. to treat another interesting topic. Please pass the information on so people can go and listen and watch this recording on our Facebook page or even on YouTube. They can learn about it so that they can prevent fire setting. Thank you for tuning in today. I am your host, Dr. Theo Oswala. You can reach me on 301-577-9111, 301-577-9111. I want to thank our sponsor, Paddock Healthcare Pharmacy. It's a family-owned pharmacy here in Maryland on Bladensburg Road. You can get your medications from there. Their phone number is 301-277-7107. Thank you, Paddock Healthcare Pharmacy, for sponsoring us. Thank you, everybody, for joining, for tuning in today. We'll see you again, same time, same place, next week Thursday at 1 p.m.